Right now, somewhere in your medicine cabinet, there might be a small orange bottle that your doctor gave you years ago, and no one ever told you it could be quietly changing your brain. Not your heart, not your blood pressure, your brain. Part of you that remembers your granddaughter's laugh, the way to your best friend's house, the words to your favorite hymn. If you're taking medication every single day and trusting that it's helping you, I need you to stay with me for the next few minutes, because what I'm about to share has been confirmed by major medical research, and almost nobody is talking about it out loud. I'm not here to scare you, I'm here to protect you. And by the end of this video, you're going to know exactly what to look for, what to ask your doctor, and how to keep your mind sharp for the years ahead. So stay with me, because point number 3 is the one that surprises even longtime patients. Let's start with a story, because I think you'll recognize someone in it. Maybe it's you, maybe it's your husband, maybe it's your mother. Her name was Carol. She was 71 years old, living outside of Columbus, Ohio, in the same brick house she'd raised 3 kids in. Carol was sharp. She did the crossword every morning with her coffee. She remembered every birthday in the family, every anniversary, every doctor's appointment for her grandkids. Her family used to joke that she was the calendar nobody needed to write anything down for. Carol had a few of the things a lot of us have at 70. A little arthritis, some trouble sleeping, seasonal allergies that got worse every year. Over time, her doctor gave her something for the allergies. Another prescription helped her sleep. A third eased her bladder issues that had started bothering her at night. Each medication, on its own, made sense. Each one solved a real problem. Nobody was doing anything wrong. But 2 years later, Carol's daughter noticed something. Carol started asking the same question twice in one conversation. She forgot she'd already watered her plants and watered them again. She got turned around driving to the grocery store she'd shopped at for 20 years. Her family assumed it was just age catching up with her. That's what we're taught to assume, isn't it? That forgetfulness is simply the toll of getting older. But here's what almost nobody told Carol's family, and what almost nobody tells yours. Some of the most common medications older adults take every day, medications for allergies, sleep, bladder control, anxiety, and even certain stomach problems, belong to a category that researchers have been quietly studying for over a decade. And what they've found is unsettling enough that some of the top medical journals in the country have published warnings about it. The category is called anticholinergic medications. I know that's a mouthful, so let's break it down together in plain English, because understanding this one word could change how you think about your own medicine cabinet. Anticholinergic medications work by blocking a chemical in your body called acetylcholine. Now, acetylcholine isn't just some obscure chemical you learned about in a high school biology class you forgot decades ago. It's actually one of the most important messengers in your entire nervous system. It helps your muscles move. It helps your bladder function properly. It helps your gut digest food. And critically, it plays a major role in memory and learning inside your brain. So when a medication blocks acetylcholine to calm your allergies, or help you sleep, or settle your stomach, it's not just working on that one problem. It's also quietly turning down the volume on a chemical your brain depends on to think clearly and remember things. For a young, healthy person taking one of these medications for a week or two, this usually isn't a big deal. The body bounces back. But here's the part that changes everything for those of us over 60. As we age, our brain becomes more sensitive to these effects, and many of us aren't just taking one anticholinergic medication. We're taking 2, 3, sometimes 4, all at once, often prescribed by different doctors who have no idea what the others prescribe. This is called anticholinergic burden, and researchers have discovered that the higher this burden becomes, especially when it builds up over months and years, the greater the risk of cognitive decline. In fact, one large study published in JAMA Internal Medicine followed nearly 3,500 older adults for an average of 7 years. People who used the highest amounts of anticholinergic medications had a significantly higher risk of developing dementia compared to those who used little or none. And this wasn't a fringe study buried in an obscure journal. This was one of the most respected medical publications in the country. Now I want you to think back to Carol for a second, because her story isn't unique. And that's exactly why I'm sharing it with you. Carol was taking an antihistamine for her allergies every single day, the over-the-counter kind that makes you drowsy, the same one many of us grew up trusting completely. She was taking a sleep aid most nights, the kind advertised as gentle and non-habit forming, and she was taking a bladder control medication that her doctor prescribed for those frustrating nighttime bathroom trips. Individually, harmless sounding. Together, day after day, year after year, they were quietly adding to a chemical burden on her brain that nobody was tracking. Here's a question I want you to sit with for a moment. When was the last time any doctor sat down with you and looked at the complete list, everything, prescription and over-the-counter, and asked how they might be interacting with each other over the long term? For most seniors, the honest answer is never. Each doctor treats their own piece of the puzzle. The eye doctor prescribes something. The urologist prescribes something else. The primary care doctor refills the sleep medication because you mentioned you weren't sleeping well. Nobody is standing back and looking at the whole picture. And that gap, that lack of a big picture view, is exactly where this hidden risk lives. I want to be very clear about something, because this is important, and I don't want you leaving this video with the wrong idea. I am not telling you to stop taking your medication. Please don't do that. Stopping certain medications abruptly can be dangerous, sometimes far more dangerous than the medication itself. What I am telling you is that you deserve to know what you're taking, why you're taking it, and whether there might be a safer alternative available. Knowledge is not the same as alarm. Knowledge is protection. So let's talk about which medications are most commonly involved, because I promised you clarity, not just concern. The first category is over-the-counter allergy medications, specifically the older generation antihistamines. Diphenhydramine is the most well-known example, and it's the active ingredient in many popular allergy pills and, importantly, in a huge number of nighttime sleep aids and pain relief formulas labeled PM. If you've ever reached for something with PM in the name to help you sleep, this is worth paying close attention to. These medications are strongly anticholinergic, and they are used by millions of older adults every single night without a second thought, largely because they're sold without a prescription and seem completely harmless. The second category is bladder control medications, prescribed for overactive bladder or incontinence. These are incredibly common among seniors, and for good reason. Nighttime bathroom trips are exhausting, and they increase the risk of falls, which is its own serious danger. But several of the most frequently prescribed bladder medications are also anticholinergic, which means they may be protecting you from one risk while quietly contributing to another. The third category, and this is the one that surprises even people who've been following their health closely, includes certain medications for depression and anxiety, particularly some of the older tricyclic antidepressants. These have been prescribed for decades, sometimes for depression, sometimes for nerve pain, sometimes for sleep. They can be incredibly effective for the right person, but they also carry meaningful anticholinergic properties. The fourth category includes muscle relaxants, often prescribed after an injury or for chronic back pain, something so many of us deal with as the years go by. And the fifth, often the most overlooked, includes certain medications for stomach issues like acid reflux and irritable bowel symptoms, along with some motion sickness remedies that a lot of us keep in our travel bags without a second thought. Now here's the part one thing you really need to hear, because I don't want you panicking and clearing out your medicine cabinet the moment this video ends. Not every medication in these categories carries the same level of risk. Researchers actually use something called an anticholinergic burden scale, ranking medications from mild to severe based on how strongly they block that acetylcholine chemical we talked about earlier. Some medications on this list carry a very low risk, others carry a significant one. And the danger, according to the research, isn't usually about taking one of these medications once in a while. It's about long-term, daily, cumulative use, especially when several are combined. Think of it like this. 1 cup of coffee in the afternoon probably won't keep most people up all night. 5 cups of coffee, every single day, for 10 years straight, that's an entirely different story for your body. Anticholinergic burden works in a similar way. It's the accumulation over time that researchers are most concerned about, not necessarily the occasional use. So let's go back to Carol, because I want you to know how her story continued, and I think it's going to give you real hope. Carol's daughter, an occupational therapist by training, started noticing patterns most families miss. She started writing down every single medication her mother was taking, prescription and over-the-counter, and she brought that complete list to Carol's primary care doctor. Not a specialist, not a neurologist, her regular doctor, the one who'd known her for 15 years. That one conversation changed everything. The doctor looked at the full list, something that had genuinely never been assembled in one place before, and immediately recognized the pattern. The nightly allergy medication, the sleep aid, the bladder medication, they were stacking on top of each other in a way nobody had connected before. Working together, the doctor and Carol's family found alternatives. A non-drowsy allergy medication that didn't carry the same anticholinergic properties. A different approach to sleep that didn't rely on medication at all. A different type of bladder treatment with a much lower cognitive impact. Within a few months, Carol's daughter noticed something remarkable. Her mother stopped repeating herself in conversation. She found her way to the grocery store without any confusion. The crossword puzzles got easier again, not harder. Now, I want to be completely honest with you, because trust matters more to me than drama. We can't know with certainty that the medications were the entire cause of Carol's confusion. Memory changes in older adults can come from many different sources, and no single video, including this one, can diagnose what's happening with you or someone you love. But what we do know, based on real published research, is that reducing unnecessary anticholinergic burden is one of the very few dementia risk factors that is actually within our control. Unlike genetics, unlike age, unlike family history, this one, we can actually do something about. And that, right there, is why this story matters so much. Let me share something else with you, because I think it will help this all make sense on a deeper level. Your brain, even right now, even today, has something remarkable called neuroplasticity. That's just a fancy way of saying your brain can adapt, rewire, and in many cases, recover function, especially when the thing that was interfering with it gets identified and addressed. This is genuinely hopeful news. It means that for a portion of the memory and thinking changes seniors experience, the door isn't necessarily closed. Sometimes, it's simply been left unopened because nobody knew where to look. Now, I promised you clarity, so let's talk about exactly what you can do, starting today, whether this applies to you, your spouse, or someone you love and care for deeply. The first step is what I call the kitchen table inventory. Sit down, maybe even literally at your kitchen table, and write out every single medication you take. And I mean every single one. Prescription medications, over-the-counter pills, vitamins, sleep aids, allergy medicine, anything you keep in your bathroom cabinet, your purse, or your nightstand drawer. Most seniors are surprised when they actually see the full list written out on paper for the very first time. It's often longer than they expected. The second step is bringing that complete list to your primary care doctor or your pharmacist, and specifically asking this question: could you please review this list for anticholinergic burden? That exact phrase matters, because it tells your doctor precisely what you're asking about, and most doctors, when asked directly and specifically, will take the time to genuinely review it with you. Pharmacists, in particular, are often an incredible and underused resource here. Many pharmacies offer what's called a medication therapy management review, completely free, where a licensed pharmacist will sit down with you and go through your entire list in detail. The third step is asking about alternatives, not demanding them, simply asking. If you're taking a first-generation antihistamine every night for allergies or sleep, ask whether a newer, non-drowsy option might work just as well for you. If you're on a bladder medication, ask whether there's a version with a lower cognitive impact, because these do exist, and some of them work very effectively. The fourth step, and I think this might be the most important one of all, is patience with the process. This isn't about making dramatic changes overnight. It's about a thoughtful, gradual review with your doctor, over weeks and months if needed, always guided by a medical professional who knows your complete health history. Please, never stop a medication on your own without talking to your doctor first. Some of these medications, especially certain antidepressants and muscle relaxants, need to be tapered slowly and carefully to avoid uncomfortable or even dangerous withdrawal effects. I also want to talk directly to the adult children watching this video right now, because I know a lot of you are here on behalf of a parent who might be the Carol's daughter in your own family story. If you've noticed changes in your mom or dad, more forgetfulness, more confusion, more repeated questions, please don't jump straight to assuming it's simply age or the beginning of dementia. Do what Carol's daughter did. Write down the complete medication list. Bring it to their doctor. Ask the specific question about anticholinergic burden. It costs you nothing but a little time, and it might open a door that changes everything for your parents' remaining years. Now let's talk about something equally important, because I don't ever want this channel to leave you feeling helpless. There's a great deal within your control here, starting today, regardless of what's currently in your medicine cabinet. Sleep is one of the biggest areas where seniors reach for anticholinergic medications, often simply because nothing else has ever been suggested to them. But there are proven, medication-free approaches that genuinely help. Keeping a consistent bedtime and wake time, even on weekends, trains your body's internal clock in a powerful way. Limiting screen time in the hour before bed makes a real difference, because the blue light from phones and televisions actually suppresses the natural sleep hormone your brain produces. A cool, dark, quiet bedroom sounds simple, but it remains one of the most effective sleep tools we have. And gentle daytime movement, even just a 20-minute walk, has been shown in research to improve nighttime sleep quality in older adults, often as effectively as medication, without any of the cognitive risk. For allergies, saline nasal rinses, air purifiers in the bedroom, and newer non-drowsy antihistamines can often provide real relief without the same anticholinergic burden as the older generation medications. For bladder concerns, pelvic floor exercises, sometimes called Kegel exercises, and they're genuinely helpful for men as well as women, along with timed bathroom schedules and simple reductions in evening fluid intake, can meaningfully reduce nighttime bathroom trips for many people, sometimes enough to reduce or eliminate the need for medication entirely. And here's something I think deserves far more attention than it typically gets. Regular physical activity, even gentle activity like walking, swimming, or chair exercises, has been shown in multiple studies to support brain health as we age, independent of medication changes altogether. Movement genuinely increases blood flow to the brain and supports the growth of new neural connections. It's one of the most powerful, accessible, and completely free tools we have for protecting our minds, and it's available to nearly every single person watching this video right now, regardless of your current fitness level. I want to circle back to something now, because I think it's the emotional heart of everything we've talked about today. When we lose our memory, we don't just lose facts and dates. We lose our confidence. We lose the ability to trust ourselves in conversations. We start avoiding social situations because we're afraid we'll forget someone's name, or repeat a story we've already told, or lose track of where we are in a conversation we care about. This isn't just a medical issue. It's deeply, profoundly personal. It touches the very core of who we are and how we experience our relationships with the people we love most. That's exactly why this topic matters so much to me, and why I wanted to bring it to you today, calmly, clearly, and honestly, without exaggeration and without sugarcoating anything. You deserve real, medically grounded information, not sensationalized fear, and not false comfort either. You deserve to know that some risk factors are genuinely out of our hands, but others, like the one we've discussed together today, are actually within our reach to address. I also want to gently address something that might be sitting in the back of your mind right now, especially if you recognized yourself in Carol's story a little too closely. If you're feeling a wave of worry right now, that feeling is completely understandable, and I want you to know it's okay to feel that way. But I also want to remind you that worry alone doesn't change anything. Action does. And you've already taken the first and most important action today, simply by watching this video all the way through and choosing to learn something that could genuinely protect your mind for years to come. Let me leave you with one more thought before we close, because I think it matters more than almost anything else I've shared with you today. Aging does not have to mean an automatic decline into confusion and forgetfulness. That old belief, the one so many of us grew up hearing, that losing your memory is simply an unavoidable part of getting older, is being challenged more and more by real medical research every single year. Yes, some risk factors are genetic. Yes, some are simply beyond our control, no matter how carefully we live. But others, like the quiet, cumulative effect of certain everyday medications, are within our power to understand, to question, and in many cases, to change, together with the trusted guidance of your own doctor. Carol is 74 years old now. She still does her crossword puzzle every single morning with her coffee, just like she always has. She remembers her grandchildren's birthdays without needing to write them down. She recently told her daughter something that has stuck with me ever since I first heard it. She said, "I got a piece of myself back that I didn't even realize I was losing." That, right there, is what this video is truly about. Not fear, not alarm. Just the simple, powerful truth that knowledge, real knowledge, shared clearly and calmly, can genuinely change the course of someone's life, sometimes in ways we never expected. So here's what I want you to do, starting today, right now if you can. Make that kitchen table list. Every single medication, no exceptions. Bring it to your doctor or your pharmacist this week, not someday, this week, and ask them directly to review it for anticholinergic burden. Share this video with your spouse, your children, or a friend who might be quietly dealing with the exact same thing Carol was, without even realizing it. You never know whose life this simple conversation might change. If this video gave you something valuable today, something worth remembering, please take a moment to hit that like button, because it genuinely helps this important information reach more seniors and families who need to hear it, people just like you. And if you haven't already, please subscribe to this channel, because we're going to keep bringing you real, medically grounded, honestly presented information every single week, the kind of information that respects your intelligence and genuinely protects your health, without ever resorting to fear or exaggeration to get your attention. Your mind carries every memory you've ever made, every laugh, every lesson, every person you've ever loved. It deserves to be protected, understood, and cared for, with the very same devotion you've given to everyone else in your life for all these years. Take care of yourself today. Talk to your doctor this week, and I will see you again very soon, right here, with more of the truth your health truly deserves.